Youth mental health is one of the most urgent issues of our time. The Stavros Niarchos Foundation and the Child Mind Institute are reimagining mental health care for children and adolescents, advancing large-scale, sustainable investments to deliver accessible, innovative, and culturally relevant treatment and care for young people everywhere.
Andreas Dracopoulos, the president of the Stavros Niarchos Foundation, just has a vision and a generosity of spirit, but also cares deeply about the world. What we share with the Stavros Niarchos Foundation is that we both believe that every child, anywhere, deserves mental health.
Mental health in children are getting worse with time. We need different approaches so we can really tackle the real problems.
1 in 5 young people experience mental health or learning challenges, most often beginning by age 14. At the same time, for the 90% of children living in low and middle-income countries, less than 20% of them receive treatment for mental health challenges. Building on the Child and Adolescent Mental Health Initiative launched in Greece in 2021, the Stavros Niarchos Foundation's Global Center for Child and Adolescent Mental Health is expanding its footprint, adapting and scaling learnings and solutions for diverse communities globally.
We wanted to figure out ways to partner and be the catalyst that would improve the quality of training, the quality of care, and the access to care in Greece. A spirit of discovery, inquiry, curiosity, but also of generosity, of wanting the world to be a better place for everyone, and particularly for everyone's child.
The Stavros Niarchos Foundation has been pivotal in allowing us to build a global network of change makers.
I became involved in mental health advocacy through my lived experiences of growing up in South Africa as a foreign national. Being in primary school, there was a lot of bullying that was happening. I also faced challenges like anxiety. I realized the importance of mental health in young people's lives, and I decided that I wanted to be involved.
I think right now is a really exciting time to consider the ways in which we might be able to replicate the activities that we're working on and apply that to new countries and new contexts.
It's important for young people to be involved in mental health solutions because if something is about us, it needs to involve us. There's a strong belief in the South African context that mental health is not linked with every other challenge or problem that we face in our lives. Some of the biggest challenges facing young people when it comes to mental health is the lack of accessible and safe mental health spaces.
We are not the drivers, we are the catalysts. We are there to help professionals to integrate evidence with community-based approaches.
By 2027, we will have 40 Stavros Niarchos Foundation fellows in clinical research and in public communication that will become the next generation of global leaders in child mental health.
We are conducting the first ever epidemiological studies in Greece, Brazil, and South Africa. This data will allow us to understand the frequency of the problems, how the services are equipped to deal or not equipped to deal with those problems, and understand the risk factors. What can we do to prevent and treat mental conditions?
We're scaling a training model that empowers educators, healthcare providers, and other professionals to better support youth mental health in all settings. By 2027, over 10,000 professionals will be trained across Greece, Brazil, and South Africa, strengthening the systems that young people rely on every day.
Now is a really important time for us to continue to build upon the progress that we've made. The model that we have really spans across so many different disciplines, and we're able to make a really wide impact across the countries that we're working on.
For us to do real change, we need to allow ourselves to do deep connections, to understand that culture has an immense value for care. It is about us allowing ourselves to connect with others in a way that is meaningful.
It starts with visiting in their spaces, in their local communities, in their schools, and seeing what their lifestyles are like, and then deciding that I want to be involved, but I first want to know you. I first want to be here with you and for you. So that's what gives me hope.